Welcome back. You're watching India This Morning. The total number of positive cases in India now stands at 606 with 42 recoveries. The total number of deaths are now 10. In fact, the Health Ministry in its briefing had stated very categorically that there is no community transmission as of now in this country. However, social distancing is the only way out. Remember, yesterday was the first day of the official lockdown of 21 days and 70 new cases of coronavirus reported on day one of the lockdown. My colleague Ayushman joining me now with all the updates from the Health Ministry and ICMR data. So Ayushman, coming to you first on the facts and figures. We are reporting a total of 606 COVID positive and also 9 deaths. Now, if you can update us with the figures and take us through the number of fresh cases reported and what are the main concerns that the ministry is handling at the moment.
Well, Afrida, first of all, for the first time yesterday, the overall cases of Indians being infected by the coronavirus went past 500. Before that, if you include the number of foreigners, it was 500. Now, from yesterday, the overall cases of positive cases of coronavirus of Indians getting infected has gone past 500. At the same time, the ICMR has said that now over 118 government laboratories are working. At the same time, 29 private labs have been given the permission and they are operating all across the country. So around 16,000 labs across the country in a chain are working for COVID detection. Not to forget, Afrida, that the government has given the permission to private labs, but the private labs are charging 4,500 rupees. This has been there, though they have been urged to do it for free, but they are charging it. At the same time, the important aspect which the health ministry is right now observing is the hydroxychloroquine. Their sale has been, their export has been completely, it has been put in the prohibited category. It has to be given to only two kinds of people who are taking care of the people who are affected and also the healthcare worker who are taking care of the people affected by the COVID-19. At the same time, important and very important thing is the PPEs, personal protective equipments. The government has said that they are trying to procure it, because some of the equipments are there which come from foreign nationals and foreign, because the current lockdown that we are witnessing right now, that has been stopped. So current focus is that non-essential surgeries have been stopped. At the same time, the PPE situation is going to improve in coming days. This is what the health ministry is saying.
Right. Those are important, information, in fact, that you've shared with us. But I want to ask you again, the challenges ahead. Now, one of the important areas is testing. And like you said, the number of testing centers will increase now with so many more private labs coming in. 118 new laboratories included now in the ICMR network. Is that sufficient, Ayushman? Because time and again we are focusing on the issue of whether the rate of testing is happening in a way that would, bring out the positive cases, whether the numbers could be much higher. That is one thing. And the other announcements that are also been made now about, the National Disaster Management also saying which are the offices that has to compulsorily remain closed. So if you can take us through the other pointers from the briefing yesterday.
Well, Afrida, yesterday the health ministry clearly briefed and said because earlier we had seen the DOPT order where it was said that almost 50% of the workforce of the government had to be there in the homes, and rest 50% will have to work in the staggered timing. Now, this was not implemented in the state level. If you see, the states have their own set of working of the rules which applies to them. And yesterday, because of the National Disaster Management Act, these offices, except for the essential commodities like electricity, fire and other services, all these offices have been told to close down. At the same time, the health ministry has clearly said that still amidst the lockdown that we are witnessing right now, still the health ministry is saying that India is currently in the limited local transmission. There has been no community transmission, and there is no proof right now with them available, so that they can conclude that there is a community transmission taking place in the country right now.
All right. So that is on the positive side. But remember, two important things. It's extremely critical now to seal the healthy population, for which the lockdown must be observed without any exceptions. And second, of course, the testing must happen at a faster pace, perhaps, which Ayushman is telling us is going to now happen with more private labs being added to the network of ICMR. Thanks for joining us with the latest information.